Yes, dear students, today we are going to discuss on how to examine a lung, and this video is primarily made for the medical students who are participating in their first clinical appointment. So this video is mainly concentrating on the basic knowledge on how to examine a lung, or else what a medical student should know before they start their first clinical appointment. So there will be a video which is mainly targeting for us medical students who are doing the second clinical appointment, and the third video then concentrating on the medical students who are doing their professorial clinical appointment. So there will be 3 videos on lump examination, and this will be the first video. Okay, so what you all should know is at the beginning it's very important to have a broader view on what you all are going to learn or what you all are going to do. Then as you go along in your clinical appointments, you can fill the gaps and you can train yourself to improve the techniques of examination. So in this video, what I am trying is to put the broader view or the eagle view of lump examination into your head. Okay, then what is lump examination? Actually, lump examination is a triad. Triad means it has 3 main components. What are these 3 components? Component number 1 is the examination of the lump itself. The component number 2 is examination for distal effects. Component number 3 is examination of the draining area. Okay, now we can concentrate on component number 1, that is examination of the lump itself. So that is the key principle that you must remember. Then there is another rule when you are doing examination, that is examination has 4 phases. What are these phases? Phase 1, inspection. Phase 2, palpation. Phase 3, percussion. Phase 4, auscultation. So now we know that there are 2 primary concepts which we can't violate. So we have to respect these 2 principles. Okay, now let's start discussing on examination of the lump itself. So we have to first do the inspection. So in inspection you have to look not only the lump but also the region where you see the lump. And what are the things that you are going to comment on is you have to comment on surgical scars or any biopsy marks if present. Then you have to comment on the color or the presence of features of inflammation which are visible. It means swelling and erythema. And the other features that we are going to comment is any change of skin, primarily the color, which means hyperpigmentation or hypopigmentation, and then changes of skin appendages, which may sometimes noticed in certain lumps. Then you have to inspect the rest of the region for any obvious abnormality that can be detected with your eyes. So after inspection, then you have to move on to palpation. So your palpation begins with you are touching the lump and compare the temperature or the warmth over the lump. and you have to compare it with another area over the body. And next thing is, you apply little more pressure over the lump and check for tenderness. Then you are going to concentrating more on the lump itself. So what is the first thing? You have to identify the site of the lump, so that you may describe in a broader way, or if you are doing it in the broader way, you even can do that in the inspection phase. If you want to go for the more fine details of site, that has to be expressed in X and Y directions in relation to bone surface marking. But that may not be that practical in board setting as well as in examination base. So after the site, you have to concentrate on the shape. So if shape is pretty obvious, you might tell it in the inspection phase, or if not, you might have to wait till you reach the palpation to confirm the shape of the lump. Then you have to keep palpating over the lump to describe the surface of the lump. So while you are describing the surface, it may be smooth surface, it may be irregular surface, or it may be lobulated surface. Those are the three common type of surface which you may detect on your palpation. So with the surface, you have to comment on the borders also. The borders also again may be regular or irregular in nature. So after palpation for the surface and the borders, then you try to define what this lump made out of. For that, you start with consistency of the lump. So consistency of the lump may be either soft, firm or hard. And we all know it may be soft as your lips, or it may be firm as your tip of nose, or it may be hard as your forehead. So you have to compare and define whether this lump is soft, firm or hard. So then what you are going to check is cross fluctuation, and the technique will be displayed in next video. Then you have to check for transillumination. So these are the three techniques which will going to help you to define the constitutions of the lump, or you are trying to define the what has made this lump. So after these things, then we are moving for special tests or special physical signs. Those are to check for pulsatility. The pulsatility may be true cross pulsations, or it may be transmitted pulsations. Again, the technique will be shown in next video. The next is emptiness, which is a defining feature for vascular lump. So when you try to elicit emptiness, then you try to check whether the lump is getting refilled. And if it is getting refilled, if when you are elevate the lump above the heart level, if it is possible, then it is likely to be arterial in origin. If it is getting refilled only when it is in a dependent position in relation to the heart, it is likely to be venous in origin. After that, we are going to check for Tinner's sign. So those are the special physical signs that you are going to elicit in a lump. So after these things, then you are trying to define the tissue plane of the lump. So there are two main component when you are defining the tissue plane of the lung. First you try to check whether it is attached to the skin. So you are trying to move the skin over the lung. Then you are trying to define whether the lump is attached to deep tissue. So there your main worry is muscles. So you first move the lump over the deep structures, and then you try to identify the muscle underneath the lump, and then you ask the patient to contract it against resistance, and then you try to move it again. You are checking for any restriction of movement, and you will be doing it in two perpendicular directions, and that's how you are going to define the deep attachments. So if so the lump may be attached to the skin, or may be attached to the deep tissue, or it may be between skin and the deep tissue without any attachment to any of those. So that's how we are going to define the tissue plane. In that way, you basically finishes the examination of the lump itself. Then what we are going to do is, we are going to check for distal effects. So your distal effects primarily important in lumps in extremities. It means either in upper limbs or in lower limbs. So what are the possible systems which can be affected by a lump? So it is either arterial. So if the arterial system is affected, what you are going to check is the distal pulses. So whether they have reduced in volume or whether they have disappeared. So that's what we are going to check. So other possible is venous. So the venous, if the venous system has got affected, it will be manifest as distal swelling. So that is difficult to elicit, but if you keep the limb in a dependent position for a longer period, you may be able to elicit that physical sign. Then the nervous system. So you are going to check for both sensory and motor function in the structures distal to the lump. Then the lymphatic system. The manifestations are almost like for venous obstruction. So difficult to elicit, but you can do the same thing which I described for venous obstruction or venous effects. So basically those are your distal effects. Then you move into examine the draining area. So your draining area is the lymphatic basin which drain the area where you notice the lump. So you may be examining one lymphatic region or two depending on the lymphatic draining mechanism or the lymphatic anatomy in the region. But your main worry is you are checking for lymphadenopathy, and that in that examination we have to follow the technique for examination of lymph nodes in given regions, which again shown to you in a different video. In this way you finishes the examination of a lump, and how we are going to analyze and come into a working diagnosis will be discussed in the third video, which is prepared for professorial students. Thank you.